denture options as it relates to how we can facilitate fit and function by the use of mini dental implants. This is where the mini implants really rise and shine. And I'll try to expand on that a little bit here as I'm showing you. We can do something as simple as stabilizing the dentures that you have, where we put small implants, the mini implants. Same day you can come in, we put them in the jaw, and then we add clips to the underside of your existing denture. They snap in place and keeps them put where they stay put. That's the most basic service. Now you say, well, doctor, I really would like to get rid of the palate covered with the plastic and get something a little more like my teeth. That's the next thing that we do, and I do, probably this is my most common one when we go to replace all the teeth. We get rid of the denture altogether in this type of treatment. They're called a roundhouse bridge. And it's supported by 6 to 8 mini implants. Now this is built from scratch. This isn't modifying what you have. So it's a series of appointments, usually 4 or 5, and then an adjustment 1 or 2. But implants in place, clips underneath. Only these clips have a rubber O-ring that functions to cushion this denture. And it allows us, the cushioning allows us not to have so many implants put in place, which cuts the cost quite a bit. I can get them out, but you can't. And what's really nice about that is you come in for your yearly, bi-yearly dental cleanings and checkups. I can remove this, have the hygienist put it in a professional cleaning solution, clean around your implants, make sure everything's spick and span again, and put it back in where only I can get it out, and away you go. I like it, and these things are very flexible what you can do with them too, as far as repairing. If you have an implant that should go bad for some reason, they're not 100% successful, so occasionally if things go bad, then in this case we would remove whatever one for whatever reason was bad and just replace it with one. Okay, and again, if you're doing your home care properly, these are guaranteed for 5 years. So, all right. Then the last, most expensive option that I do is where we put a whole bunch of these. This is an actual case that I recently finished, plaster model. All right. And in this type of denture, these are called roundhouse bridges. So it's really not a denture, even though it's replacing all the teeth. In this situation, we cement this into place. It doesn't come out. And I can't get it out either. So it's cemented in with a hard dental cement. Actually, I can get them out, but it takes some doing. And we usually leave them in place. Now, if push came to shove, there's ways to get it off of there. But it's meant to be cemented and kept in place. Most expensive option. However, if you want the closest thing to your natural teeth, this is it. And if you're thinking, oh, boy, I'd like to check this out and see if I'm a candidate for this type of treatment, once again, call the office here and get your free consultation and get on your way to a new you.